So, thank you very much. Next up, learning from stage one, we've done. I hope you've heard some messages from learning stage one. And as Sarah suggested, we will be circulating those later on this week. But now, learning from experience. People who have been there, seen it, done it, had a go, done things well, done things not so well. Noel Kelly from Dublin, Planning for Life in Dublin, Northside Partnership. Welcome.
Well, good morning everybody, or maybe it's just about good afternoon. I suppose there are a couple of caveats I want to add before I start sharing my story with you, is that things in Ireland are quite different. When we started doing this work, we were identified by a funder. So the funder came to me and said, you're somebody who looks like you have potential to do things differently. So we didn't have to go through an application process. The funder decided they wanted to work with us. The second thing I think is that systems in Ireland are quite similar to the UK, and I suppose we follow the UK following the US, if that's reasonable. And a lot of the services we have in Ireland were responses to crises. So we have a major crisis, somebody gets in the media, creates a big fuss, something has to be done. And all of the things that Naomi and Kate were talking about are absolutely forgotten about. The third thing is that we don't have as strong as local government and local systems as yourselves. In Ireland, again, because of our size, everything is quite centralised. So our education system, our local government, our policing, justice, they're all really run from the centre. So it's quite difficult to build the kind of relationships that you have here today, where you've got all of your key partners in your area. So we build relationships at local levels, but the local people don't really have the power. So we've got to go to government as well. We've got to go to the senior civil service and policy makers. So that's just to set the scene that things are slightly different, and also the scale that you're working at is vastly greater than the scale that we've worked at. The area I work in has a population of about 15,000 people. So that's just a little dot in some of your areas. So let me tell you about lab rats. I have been a lab rat and I've survived. In 2004, when Atlantic Philanthropies, who were one of our funders, came and asked me would I be willing to get involved in this kind of work, they introduced me to Michael Little and his team. And for a period of about 3 years, they tried different potions on us, and they poked us, and they prodded us, and they made us run on treadmills. And now, they've got a much bigger laboratory, so you're going to experience what it feels like. But the good news is that the experience is tough, it can be frustrating, but in the long run, it's well worth it. And I suppose that's what I'm here to tell you today. And when Naomi was presenting there, I was quite interested because I was doing a checklist in my head to see, did we do that, did we do that, did we do that? And we did all of those things. And I suppose the most difficult part we had was to choose what exactly was the action that was going to lead to the outcomes we wanted. And I know we fought quite over a period, Michael, where Michael didn't always agree with what we thought, and he really challenged us to make sure that there was evidence as to what we were doing. So as I said, I'm here to share some learning with you today, and I suppose really you're hearing from somebody who's had an experience in this field, and also knowing that the effort is worthwhile. So I suppose how we started, Atlantic Philanthropies, which are a big American foundation with an interest in Ireland because one of their founders has Irish blood in them, decided that they would like to invest in prevention and early intervention in Ireland in 2004, and they approached a selected number of individuals. I was fortunate enough, and all of these things happened because of relationships. The executive who was running the program in Atlantic at the time, I happened to have worked with his wife, so that's how I got selected. So it wasn't down to any quick work on my behalf. Our first piece of induction was that we were all taken to Penn State University in the US to meet Mark Greenberg and some of the fantastic people out there, and we were showing how things are being done in the US. And again, I suppose that was really helpful. It also allowed us a chance to share our fears with each other. And when we came back from there, we were then introduced to Michael, or in fact, probably the other way around. Michael was involved in bringing us to Penn State, but we started working with Dartington. And I think what was really interesting is that there was a common methodology that we all had to follow. Now, 10 years down the road, the science has moved on quite a bit, the methodology, and the systems are refined quite a lot. So I suppose our experience has probably helped Michael in developing that. So the methodology that we were advised to use was that there had to be an emphasis on prevention and early intervention. We had to focus on outcomes for children as the clear goal. So it wasn't about actions, it was about outcomes. We had to tailor the activities and services that we were going to develop to fit the outcomes. Evidence was central to everything that we were doing, and we had to work with local communities and agencies in an integrated way. And evaluation, and rigorous evaluation, was the norm. So it was quite interesting, and it's exactly what you said. Okay, so I'm not here really to talk to you about our program today, but I'm going to share just 2 slides with you just to give you a sense of the area we work in and what we're doing. But it's the experience more that I need to share today. So we're an early intervention prevention program designed to improve outcomes for children. So what was our need? And anecdotally, and I'm a teacher by profession, we knew that children in our particular area were failing in school. They were dropping out of school early. There were massive problems with literacy. Very few of the kids finished school and went on to university. So all of the signals were there, but it was all anecdotal evidence because our Department of Education isn't particularly good at stacking evidence like this. You may not believe it, and I suppose I shouldn't be talking down my own country, but we don't have a national pupil database in Ireland in 2013. And I suppose that's an indictment really of the people who run our education system. We did a piece of research, so we looked at all of the children who were starting school in 2004 across 3 schools in our area, and basically what we found is that 51% of those children were starting school without the basic skills that they needed. Now we measured that using a Canadian instrument, the EDI instrument, and I'm sure the researchers here would understand that instrument because we don't have a norm for school readiness in Ireland. And having done that, it confirmed, I suppose, our anecdotal thoughts, and the challenge then was to design and deliver a service that would practically demonstrate an effective way of improving school readiness outcomes in our area. Now again, these are just a few stats from the last 2 censuses in our area, so it probably resonates with some of your areas. Our lone parent ratio is extremely high. In 2011 in our area, 52.5% of our families are lone parent families. That's 2.5 times what it is in Ireland in general. Our proportion with only primary education, so these are people who left school at approximately age 12 with no qualifications, 40% of our parents are in that category. We're way behind in relation to 3rd level education, and we're also way ahead in relation to unemployment. Now these figures are 2011 when we had our last census. Things have improved a little bit in Ireland since our unemployment rate has come down. But most of us believe that that's because of immigration, because we have very significant immigration at the moment. Okay, so my journey, I suppose, I wanted to make a difference. So I started out as a teacher working in Darndale, which is, I think, seen as in the top 10 most deprived areas in Ireland. And I taught in the classroom for a while, and I realised that I could make a small difference in the classroom, but by getting out of the classroom and doing other things, I could probably make a bigger difference. And this has been a long and interesting road. And the signpost there, success and failure, you're hanging on the middle of that all the time, that you can make a wrong move and go down a blind alley. And also, you cannot see what's ahead. And when I started in 2004, we envisioned all of this, but we really didn't know where it was going to lead us. So I've become a juggler. And my role now in the area is I'm a program developer, a designer, a leader, a facilitator, a researcher, a team builder, a convincer, and a policy informer. So you're a little bit of everything. And you've got to dabble in all of those areas, and you've got to have a little bit of knowledge about each of them. I also had to change my own beliefs and mindset, and I think that was probably the biggest challenge, that you have to believe that there is a better way of doing things. You also have to convince yourself that this is the right way to do things. I always like doing things for people, and it's always great to do nice things for people, but I think as the experts have said, doing nice things doesn't always get you results. Having expert help, I think, is really important, and I really would say to you, use the experts. There are lots of experts around the world with lots of knowledge in this area, and they're only delighted to help. I have been absolutely amazed that I now can count people like James Heckman among, acquaintances of mine. These people love to talk to you. If you're doing work that they're interested in, they will talk to you and they will give you the benefit of their expertise. The logic model, I'm not sure, have you all used the logic model? Not yet. Okay, well, the logic model is going to become your friend. All of my staff have the logic model taped up to their workstations, because when you need to remind yourself why you're doing this work, you need your logic model. And I think what's really interesting about the logic model is that normally in Ireland, and I'm sure it's the same here, when we saw a problem, we started from the problem. With the logic model, you start from the outcome and you work your way back. So you figure out where would we like to be in 2 years, 3 years, 5 years, and then you figure out what do we need to do to get there, which I think is a really interesting way of working, and it's also a lot more logical than the other approach. Commitment and sticking to decisions is really important. When you make the tough decisions, they're made. Stick with them. But before you make the tough decisions, make sure that you're well informed. And a big part of this, and it really resonates with what Naomi said, you have to have all the partners on board. If you leave any of the partners out, it's going to come back to bite you. You have to spend time and make sure that everybody is in that room. And it's quite interesting, in the community experience, we brought lots of people from the community in, but we brought the noisy people in as well, because if you left them outside, the last thing you need were enemies like that. So you have to bring them in, but you also have to bring other people in as well. So I suppose there were 5 key steps on our journey, and I'm going to share just a little bit of learning, and I'm framing most of the learning positively, because some of the things we learned, we made lots of mistakes, but mistakes are learning opportunities. It doesn't mean that it's the end of the road. And I think we were very fortunate that our funders and our supporters were very understanding that we were going to make mistakes, and they told us at the start, you're going to get it wrong sometimes, but what you do is you get up, you dust yourself down, and you get on again. And if you do hit a cul-de-sac, go and ask an expert. And that's the one thing I'll remember from Michael Little to the day I die. If you're stuck, ask an expert. Fairly simple advice. So in the consultation, in our programme, everything was about local leadership. So the programme was driven by local leadership. So my job was to facilitate that. And we got all of our school heads, our health people, our police, our local authority, we got all of those people around the table. In fact, at one stage we had 28 different organisations and agencies working with us through the planning phase. We were fortunate, like yourselves, we got commitment to a planning phase. So Atlantic gave us a grant. At the time it was €100,000, which was fantastic. So that enabled us to spend time planning and to do it properly. We got agreement of interested parties all the way through, and I think this is one of the things I would really advise you to do. Don't move ahead until you have agreement from everybody. If you leave people behind at different junctions, then you're creating problems. Mind the relationships. And there are people you're going to work with that you're going to find really hard, and you're going to say, is it worth spending time with them? But I'm saying you have to. You don't have a choice. So even the people who are reluctant, you've got to work with them. Conducting and analysing research to confirm the need is really important. So anecdotally, people think they know what's going on, but they can have it very wrong. And I think the worming experience explains that more than anything I can tell you. Information gathering, and I know you're some way on this journey already. It's really important to visit sites. So if any of you are interested in coming and seeing what's happening in Ireland, we'd be delighted to have you and to come and meet the people. Similarly, look at different models and programmes. Meet the experts. Engage with the funders, because the funders have an agenda, and I think Andrew has said that already, but the funders have some ideas of what they would like as well. So don't, take on board what they're saying. And I think the one thing that we've always done is honest and timely feedback. Is don't try and hide problems. If something is going wrong, name it. And we found that funders, in fact, appreciate that. Because in the past in Ireland, we've always done what we thought was evaluation, but we always knew the result before we started the evaluation, because the result really was what you needed to convince the funders to give you more money. I don't endorse that approach, and I don't use that approach anymore, but unfortunately, that's still the way that some people have to work to get the funding, is you have to create this piece of evaluation that tells the funders that you're doing great work. Service design, and I think this probably is one of my as well, is this is the hardest part. So you've identified the need, you've figured out what the problem is, and now you're trying to figure out what are we going to do about it. And there is a little bit of merit in working in it. But the things that work for us is being helped to use evidence to design the programme, and the logic model really, really helped with this. And it took us probably a year to build the logic model, but having built it, we kind of said, why does it take us so long? It's so simple. But you have to get into the mindset, you have to get into the thinking about how things work sequencing. Also, having a multidisciplinary service design team is really important. And I know there's been quite an emphasis on health here this morning, but you must have your educators and your local authority and your police and your community around the table when you're designing. Because we have that delicate balance all the time, is that people sometimes think this is all about health, all of the problems in that area. It's about all of the pieces working together. You have to explore different possible interventions and identify the one that's going to give you the outcomes you desire. Again, agreement, and I'm emphasising this, don't move forward until you get agreement. Now, we also got involved in designing a programme manual, because our programme has been evaluated using a random control trial. So again, the programme manual was quite a difficult piece of work, but having done all of the preparation wasn't that difficult, because at least we knew what we needed to do. And our biggest challenge was convincing the board of our organisation that we could do a random control trial. They fought it for 6 months. People told us it's social engineering, The community won't like it, the parents won't agree to it, everybody's going to be protesting, you're going to have people with placards outside your gate. We got past the board after meeting with a number of experts, people like Michael and also some other experts. We've had one prank call in 6 years since we started implementing. There was a message left on our phone one day from somebody saying, what you're doing is wrong, you shouldn't be doing this with families, but they didn't identify themselves or didn't leave the number, so I couldn't ring them back to argue the point. But I think that's quite interesting that people think there are going to be objections, but oftentimes there aren't. If you do things well, the families, in fact, are quite happy and they understand what you're doing. So again, in the preparatory phase, we used an existing organisation as our governance agent. So an organisation that I work for, North of Partnership, has a track record of working in the area since 1990, and it had good credibility and good acceptance. And all of the other service providers were happy to engage because they knew that this organisation wasn't in it for its own means, it was in it because it wanted to do good. So I think that's really important. And I think you've already identified lead agents, and I can see that quite a few of them are organisations like Bernardo's and other services like that. Staff is really important, and this is where we made some of our most crucial mistakes. We recruited the wrong people. And we've learned quite a lot from Karen Blasey and people like that now in relation to implementation science, that you have to get your recruitment right. And it's only when you start delivering to families that you realise you've got the wrong people. And a lot of it has to do with people's beliefs, it has to do with people's methodology. So again, we have let staff go and we've encouraged people to leave, and I would really say that you be careful when you're recruiting. There are lots of people who are really enthusiastic, but if people don't believe in the programme, it's going to be really difficult for them to deliver. We also involved our staff quite a lot in refining and developing the materials, and also we picked pilot families. So the delays that we had on some issues like ethics and that allowed us to go and test the materials, test the process on families. And our pilot families are still with us. So some of them have been with us for 9 years. They're still testing out instruments with the researchers. Okay, so from implementation, what did we learn? Recruitment was much more complex and slower than expected. Now, because we were doing a random control trial, we were recruiting some of our families through the community, some from GPs, some from primary healthcare centres, but the majority through maternity hospitals. And in Ireland, maternity hospitals are notoriously difficult to work with. They're very reluctant to share information. So they made it really difficult for us to recruit. So we found recruitment, and I think you probably will find that yourselves as well. In theory it sounds simple, in practice it's quite difficult. It takes time to reach a tipping point as well. That in the community, people are suspicious of new programs and new approaches. In Ireland, people hate social workers. I'm not sure if it's the same here. And families, and it's not that social workers are bad people, but families have this misguided notion that social workers take your children away. So that's the association that's made. So when we started, families thought we were social workers. They thought we wanted to come into their homes to see how much money they were earning, to see who was living there, because in our communities, quite a lot of the families they're faking things for social welfare benefits. So you need to know that. But we had to assure them that that wasn't our job, that we weren't coming in to look for information. We had a responsibility around child protection. We were very clear with them that if we saw anything around abuse that was a child protection concern, we had a mandatory responsibility to report it, but we weren't reporting who was living in the house or what incomes were coming in. And the tipping point was quite interesting. It came about a year after we started, when enough families were in that it became okay. I've mentioned staffing already. Quality and fidelity is also really important, and I suppose we've learned quite a lot about this in the last years. We have to have ongoing coaching and monitoring. So just because a staff member has good intentions, it doesn't mean they deliver the programme well. And there's programme drift where people can get distracted and people can have good intentions going into a family. And families in these areas are quite good at distracting you as well, because sometimes they don't want you to get to where you want to go. So they find all ways of screening you out. Perseverance and patience with hard to reach families is really important. And we've done everything that has ever been thought of, from knocking on doors to nice postcards to text messages to little gifts. Some families are difficult to engage with, and those families, for a variety of reasons, you have to work extra hard with them. And I know sometimes my staff are frustrated and they're saying that we're rewarding bad behaviour by constantly chasing these families. But we have to keep reminding ourselves that our goal is outcomes for children. And if we want to get to the children, we have to get to the parents. Celebrating success is really important, because the gains can be small, they can be very slow. So you have to, when something good happens, celebrate it. It doesn't mean you have to go drinking or partying, but just give somebody a pat on the back and tell them they've done a good job. And maintaining honesty and quality with relationships with our funders and evaluators is extremely important. So if you'd like to know, I'm going to be ahead of time, so I just want to tell you a little bit about where this has got to in Ireland. So up to 2002, children were seen and not heard in Ireland, really. We didn't really think too much about children. They were a commodity, and whatever families did with them was okay. So in 2002, we had our first junior ministry for children in Ireland. In 2004, the Prevention and Early Intervention Programme came along. Also in 2004, an ombudsman for children was appointed, and she has made a significant difference in tackling some of the big issues. In 2007, after Atlantic had been working with us for a number of years, government agreed to come on board as co-funders, and the process that Atlantic used is very similar to what the big lottery fund are saying. They put up some of the money, but it was on condition that government matched it. And I think that was really good, because without that, I don't think we'd have got government to the table. So government had lots of other priorities at that time in Ireland. They were big into building more and more buildings, getting ready for the big crash. But really they weren't too interested in children. Bankers and property developers were their friends. The Department of Children with the full ministry was only established in 2011. So really our Ministry of Children is only 2 years old. And we have a fantastic Minister for Children at the moment who's really dynamic, but she is fighting an uphill battle. Because all of the other departments are saying, right, children, you look after yourselves. They're the junior department, they don't have many staff, so it's quite a challenge for them. We also established the Prevention and Early Intervention Network, and I know that you have similar type networks in the UK at the moment. All of the sites who are involved in this kind of work in Ireland, we work together, and Atlantic again have put some resource in to help us to develop that network. And that has given us a lot of clout. So we now get invited to the policy briefings. We now get invited to meet the Minister, because they see it as a collective of people who are doing similar work. And the good news is that unexpectedly we had started planning for sustainability when in Budget 2013 government announced some funding to extend the work that we're doing. So that was a little bit unexpected. It came from a small number of politicians who really have been pushing ahead. So the good news is that we've up to 10 sites are now going to be jointly funded to expand the work that we're doing in the next 3 years. And it's very similar to yourselves. The objective in the next phase is to change practice across existing services. So it's not about creating another layer. So in my area now, we're starting to work with early year services, we're starting to work with the health services, the maternity hospitals, the public health nurses, the primary care centres, so that they start doing business differently. So it's quite similar to what you're driving for yourselves. And the evidence from the current sites influenced that decision. So some of the positive evidence that we're generating helped convince people that this is a good thing to do. But interestingly, I was just saying to George, and George has been over in Ireland speaking to our politicians and policymakers, and some people in our government now feel they've done it. So they've done the evidence for the last few years, so that's okay, that's done, we don't need to do it again. And we're trying to convince them that we're just at the beginning of a journey, that this is a lifetime's journey, it's not something you finish quickly. Our network has been very successful in lobbying politicians, policymakers, etc. And I suppose learning opportunities have been created. So really, really good international people, the likes of Steve Ailes and people like that, have been brought over by Atlantic Philanthropies and the network to speak to our policymakers. So we're trying to engage them with people who are really expert at this. So my take-home messages for you are to invest adequate time in the planning and service design phases. There are no shortcuts. And it's always difficult when there's funding dangling there. Everybody wants to write this fantastic proposal that will get the funding, but a fantastic proposal that's not grounded will not get you a good programme that will generate outcomes. And I think that message has been delivered by all of the speakers this morning. The process is as important here as the piece of paper that comes out at the end. Because if you've got all the partners engaged and moving in the right direction, then it will work. Invest time in building relationships. Take any help you can from experts. And be very open and honest in your reporting. So if something goes wrong, that's fine. Things will go wrong. Because if you remember, this is a learning process. We're not going to get it right the first time. Pick your staff carefully, and this is something I've learned the tough way. I've picked a number of staff who haven't worked out, and we're now much, much more careful in screening staff. And not everybody can do this kind of work. So it's tough work when you're working with families. And if you think of it, it's taken generations to get some of these families to where they are. You're not going to fix them in 6 months, but you have to get the right people in there working with the families. Work closely with your evaluators. And in Ireland, traditionally, evaluators were out here, programme developers were here. We've got together and we're working as a team with our evaluators, and it's been a fantastic experience. Yes, the evaluators put a lot of demands on you, but in return you get an awful lot back. And you also get access to other opportunities. I've been on a little bit of a circuit lately. I was only in Denmark last week, and it was through our evaluators because they had built a relationship with the new research centre over there. So stay close to your evaluators, they will generate nice opportunities for you. And finally, be prepared to scale up. And I suppose we started small and we thought small and we were thinking really small, and it's only in the last few years we've thought, actually, if this works, we've got to be ready to move to the next level, because doing something really small isn't really going to change things nationally. So we're in the process of scaling up, and we're going to be working with a multiple of 8 times as many families as we worked with in phase 1. So it's a nice size scale up, it's not too demanding, but we've got to be ready again if we're successful in this phase to go maybe a multiple of 8 again. And that changes the dynamics. So my role has really changed. Instead of being somebody who's managing the program, I am now managing at a different level. And you've got to be building successors, people who can step into those roles. So I hope that was helpful for you. I'm really saying to you, it's a tough journey, it's an exciting journey, but it's well worth it in the long run. And I know the work that I'm doing now is so much better than I did for the first 20 years of my career. And I'm just sorry I didn't have this kind of information available to me when I started my career. So again, I wish you all the very best, and I know this competition still, so you're all bidding against each other, but maybe we can talk to Andrew about increasing 3 to 5 to 6 to 10, because that's what we would do in Ireland. We try and bring as many people as possible on board. But thank you very much for the opportunity to speak to you, and I'm around for the day, and I have a number of websites, so if you want to get more information on our specific program, the top 2 websites are our organisation website and our program website. The third one is all of the programs in Ireland that are working on prevention, early intervention at the moment. And the bottom one has all of our research reports. So again, I'm sure these are going to be shared. I'll leave the slides with people later, yeah? So you don't have to be writing really fast. Okay, thank you very much.